Okay, we are back. We're back. I'm going to show, before I show a couple of videos, I want to ask my colleague, any comments you want to make related to that study or anything else, or questions you want to make? We're going to get to questions in the audience also, so help me look out for questions and comments in the audience. I didn't look at the chat so well, but anyway, any comments before I get to some of the videos? Some of these videos are going to show, but it'd be pretty impressive. And I know, Dr. Atkins, you've seen this before. Let's take a look at the first one. This shows.
Are you currently using this, Dr. Montgomery?
We're going to start using this within the next week. Dr. Atkins has been using this for years, and he's going to share his experience with this. But we plan to start using this within the week, and we're going to start integrate this. I'm going to share some of the protocols we're going to add to our treatment session. But we plan to start very soon. Let's take a look at this image here.
Breathing. Breathing is the first thing we do when we're born and the last thing we do before we die. We can stay alive for long periods without eating, drinking, or sleeping. But if we cannot breathe, we die within a few minutes. Oxygen cannot be stored. It must be replenished continuously and steadily. Once inhaled, the oxygen makes its way to the lungs and hitches a ride with the red blood cells. Oxygen gains access to the body's cells through an internal network of vessels. Your heart is a champion. It works non-stop 24/7. Your heart electrifies itself, maintains blood pressure, and acts as the major pump to get your blood moving. The heart, together with the entire network of vessels, are known collectively as the circulatory system. Although it's easy to think of these vessels as a glorified plumbing system found behind the walls in your home, blood vessels are actually active, dynamic organs capable of contracting and expanding as they deliver nutrients and oxygen, carry away waste products, and help maintain blood pressure. Along the way and further from the heart, the blood vessels become smaller and smaller, like branches of a tree. By the time blood reaches these small areas, the big pump and push that the heart supplied could use a little help before reaching their target tissues. And though it may appear as if the blood doesn't have to travel far at all, the blood vessels, if strung together, would equal a length of 100,000 kilometers, or 75,000 miles. That's enough to go around the globe nearly 2.5 times. So the pump and vessels together make a closed system that begins and starts at the heart. The same 5 liters of blood cycles through your body all day, every day. To make this long journey, our blood vessels rhythmically contract and relax. This greatly assists the delivery of oxygen and nutrient-rich blood to all organs and tissues. This vasodilation process is vital to normal functioning of our entire body. Every part of our body needs blood to deliver oxygen and nutrients. And just like the trash man, we need blood to take away all the built-up wastes, such as carbon dioxide and lactic acid. The rhythmic vasodilation and vasoconstriction doesn't always work as well as it should. Lifestyle factors and age can play a role slowing down the heart's important helper. Diet, exercise, sleep, and how many candles on your birthday cake are all contributing factors. What happens is, because the contractions of the smaller blood vessels aren't occurring as frequently, there is less oxygen and nutrients being delivered to organs and tissues. This also means there is less waste being removed. Over time, this can lead to dysfunction. If the dysfunction accumulates for a long enough period, many cells and tissues become chronically stricken with waste buildup. In addition, these tissues are also forced to contend with prolonged lack of nutrition. You may start to notice this in a variety of ways, such as a lack of energy, poor fitness, and challenged sleep routines. BEMER therapy devices promote the foundation for health, and for more than 2 decades have been developing patented technology aimed at providing a non-invasive, non-chemical mechanism for the improvement of blood flow.
So that gives a nice overview of the circulatory system. And this next video is going to be a little bit shorter, but it's going to show actual laser Doppler images of microvasculature and show some before and after flow. I think this is going to be pretty impressive. Hold on. Oops.
BEMER before and after comparison during an 8-minute treatment. Changed function condition of microcirculation after stimulation of locally and superior regulated vasomotion. Initial conditions: no vasomotion, slow blood flow, hardly any supply of white blood cells, and the capillaries are not perfused. Just after the beginning of the BEMER treatment, you will see minor vasomotion, a minor increase in blood flow. Capillary is gradually being perfused, and aggregation of red blood cells dissipates slowly. During the BEMER treatment, it indicates strong vasomotion, quick blood flow, and an increased supply of white blood cells. Immediately after the BEMER treatment, notice significantly increased vasomotion, quick blood flow, and nearly adequate supply of white blood cells. For comparison, let's take a look at before and after the BEMER treatment. Once again, before the BEMER treatment, and now after the BEMER treatment.
So there you have it. You get a nice overview of the circulatory system, how things work, and those are real images that were taken before and after treatment, and using some of the laser Doppler and light spectroscopy technology that I talked about earlier. So anybody, Dr. Atkins, you have quite a bit of experience with this, and share with us your experience and your take on this, and if you want to add to any comments I've made, feel free to do so.
Well, can you hear me?
Yes.
Yeah.
Okay. Yeah, we have been using the BEMER, I guess, over 5 years in our facility, and mainly because we wanted to use it as a therapy to improve blood flow. We always talk about exercise and circulation, and it's important, but the take-home point I want the audience to understand from this is that circulation is everything. If you have circulation, not only do you get the nutrients to the tissues that you need and oxygen, but you also remove waste. So the BEMER has a side effect to be able to detoxify as it well as supplies the nutrient value to your body. And, as a podiatrist for many years, one of the biggest issues we saw with patients was the peripheral vascular disease, which means your feet and legs, which are the most distant point away from your heart, are the last place to get blood flow. And so you start developing problems. And, I guess we mentioned earlier when we talk about the, blood supplies, not only the tissues and the blood vessels, especially in diabetes, you see a lack of supply to the skin. And that's when you start having skin breakdown, you have diabetic ulcers, you have hyperpigmentation, you have all these conditions related to a lack of oxygen to the tissues and a lack of nutrients to the tissues. But also, when you have a lack of nutrition or oxygen to the tiny nerves in your feet and your fingertips and your hands, those nerves tend to go to sleep, and we call that peripheral neuropathy, or it's a numbness in your hands and feet where you don't feel anything. You have a good sensation. You also can have in the circulation you have actually vessels that supply other blood vessels. We call them vasorum. Yeah, they apply to other blood vessels. So if you cut off the supply to a blood vessel or even supply to the heart, then you get dysfunction there. So all those things lead to the breakdown of tissue in the hands and the feet, and we see it. Same thing with the eyes. Retinopathy is another thing with diabetes. Small blood vessels that supply the retina and your eyes tend to get clogged up, can get blocked up, and therefore you start having vision issues. So we see people when they have high blood sugar levels, and I'm using diabetes as one example. This applies to any condition. I don't want people should understand that this technology is not just for a condition or disease, but it's for overall wellness. And if you can increase circulation and keep it at a high level, then your body will take care of itself. It'll get the immune cells that we need to circulate to the places they need to get to fight the infection. It also get the oxygen to the areas that it needs to be able to produce energy, because energy is a big thing, but you have to have oxygen to the tissues to produce energy. And every mitochondria in our body is waiting for that oxygen. And if it doesn't get it through the blood flow, you fatigue, chronic fatigue, all of the conditions is related to fatigue issues. In our facility, we would do the approximately 8-minute treatment, and 8 minutes sounds like a short period of time, but let me tell you, you could do 8 minutes, and I've done it myself for a number of years. That was my regimen, 8 minutes twice a day. But not only do you feel rested after you do that, but it really energizes you, but one of the big things that when we'd have patients or clients come to the office and they would do the BEMER treatments, they would go home that night and they would say, this is the best sleep I've had in weeks and months. I haven't had this best sleep in my life, because the relaxation that it does to your body also helps you sleep well at night. And that was something that was kind of unexpected, because there are, with the technology, there are settings that you can use to be able to, it's a sleep mode on there that you can actually run it throughout the night, but you let it run at a very low frequency, and it helps people sleep. So it's another tool to use instead of, taking a medication route that has a side effect of, you walking in the dark and out in the street and driving while asleep and all those kind of things, which we not healthy or safe. So we've had some great experiences with it personally, as well as with patients. We've been talking about BEMER technology, but the real technology is called the pulse electromagnetic frequency, which is a pulse frequency that stimulates blood flow. But what BEMER does, when you use a pulse magnetic frequency, the technology has been around for maybe 40 years. It has about 300 cycles per second to increase blood flow, where the BEMER technology does the same thing, but it has about 1,200 cycles. So it gives you almost 4 to 5 times greater efficiency increase in blood flow than other technologies. And I've researched technologies 2 years before I invested in a BEMER, just to see what really worked and how it worked. And I was just impressed with it, because although they do the same thing, none of the other technologies compared to that. BEMER is a patented technology. And again, I'm not trying to sell BEMER, but I'm just saying, if I want to talk about it, I want to talk about the top line of technology when it comes to helping people. And that's what we've seen.
There are a number of questions that came up, and someone asked about lymphatic drainage. What effects does this have on lymphatic drainage, from what you know, Dr. Atkins?
Well, it's going to improve lymphatic drainage also, because, again, lymphatic drainage is a result of fluids being pushed into the capillaries or arteries and perfusing tissues. And then it goes back into the system, and your lymphatic system, and drains out. So if you can increase that blood flow through the tissues and perfuse the tissues at the end of the capillary system, arterial system, you're going to get a better drainage. You're going to get, and then by adding things like massage to it, you're going to really improve your lymphatic clearance. So I think it's a great tool for that. Again, it's just an assistance for what your body needs to do already and can't do because of poor diet, poor nutrition, a lack of exercise, and those kind of things.
Now, someone also asked a question about vibration plate and circulation. We know this is not a vibration plate, but we're talking about electromagnetic fields. There's a little bit of a tangential question, but either of you have any experience with vibration plates or the benefits thereof?
Just to tie in with the lymph, the basic lymph drainage, rebounding, vibration plates, these kinds of things are going to help with lymph. For the people who are asking about lymph drainage, and you can also do lymph massage. You can actually do massage that actually targets like moving lymph around your body, but massage in general is helpful for lymph drainage too.
So massage, rebounding, lymph drainage. So it'd be a synergistic treatment. So again, it's not necessarily one magic bullet, but synergistic therapies, depending on what can benefit you.
Yeah, I have a question though, Dr. Atkins. You were just mentioning pulse, and I actually, I researched this because I was putting together, this is when I was putting together a treatment plan for my dad, and he's doing really well now, and I was going to have him do this at some point, but so is pulse different from this BEMER thing, or it's just it's an older version of it? I'm confused about that part.
Well, the pulse are sine waves that they have put together that's supposed to improve circulation. They have, they have a sine wave called a sawtooth wave. They have a up and down sine wave, a traditional sine wave. But a BEMER wave is an oscillating wave that vibrates about 1,200 times per second. And they use it to carry, it's a carrier wave for pulse therapies. So it will give more pulse frequency to the tissues. So it increases the effectiveness of it. BEMER is developed by this scientist in Germany. It's actually German technology, and he invented and patented the BEMER technology. The BEMER wave is what it's called. It's patented in 5 different countries, so they use that as a carrier wave, and that's the only difference between BEMER and the other waves. But the BEMER is a carrier for pulse waves, and then what they do is they can actually pile on maybe 3 or 4 different pulse electromagnetic waves on one BEMER wave. So you're not just getting one wave, you're getting 3 or 4 waves at one time. And so it affects people in different ways. And that's why it's so effective in all parts of the body. Some of the pulse waves, they work better in skin. They might other pulse waves work better in organs. Other pulse waves work better in maybe in the hands and the feet or in parts of the brain. But with the BEMER technology, what they found out, and this was, I did the research on it, and there are a lot of abstracts and PubMed that talks about the technology and how it works. And there's some specific things about BEMER is what I liked about it. They talk about pulse electromagnetic, and most of companies will give general information about how it works, but BEMER has specific test results or studies that show their particular results. So yeah, it's really good. I use it on my father-in-law. I've used it on my mother-in-law, on ourselves. But, I think using it consistently, memory function, because it increased circulation to the brain also. When you lay on the mat, you do it that way. They have other devices that you can use for different treatment regimens.
You mentioned you use it yourself too. So is there a reason why the treatment is so short? Would too much be a bad thing? If you
Sosa wants to walk around in a BEMER jacket,
I'm just saying,
They have a BEMER belt. They have a belt that you can put around your waist for people who have low back pain, or people they get stiff back and their back gets stiff, lower back, and they put it around your waist. And you got about an 8-foot cord. You can't walk too far, but at least you can get up, you can move around, you can put it on your shoulder, around your neck. What it does is increase circulation in those areas, so it warms you. It removes lactic acid buildup for people who work out, but it helps with inflammation, because it's really by increasing that blood flow. If you're eating that alkaline diet like we should be eating, you'll reduce inflammation, and so it will help that way. But did I answer your question?
Yeah.
Yeah. So basically, a healthy person can do it. And it sounds like there might be a cap to how often I should be doing this if I'm a healthy person.
You can actually sleep with it, right? Floyd talked about
sleep with it. Healthy purpose is needed if you want to stay healthy, because everything in our life is really slowing down our circulation. I look at aging as a function of decreased circulation, and cardiologists can tell you all about that.
Yeah.
You know, because as you age, it's everything is a decrease. You know, whether it's memory loss, whether it's cardiac function, whether it's mobility, whether it's muscle circulation, everything goes back to that. You know, aging with the skin, it's a lack of blood flow, and so it all comes down to that. But I don't think you can do too much, to be honest. I one time I was doing 16 minutes 3 times a day.
Wow.
And I would do more. And you put on sleep mode, which is a very low mode, and you can actually go to sleep on it. You know, we've had clients who put it in their beds under their sheets, and they put it in. So when they get in bed, they have a sleep mode on it, put it on, and they sleep through the night like you know, like what's those medications, sleep medications that
it sounds like a grounding mat on steroids. Like it just sounds like really like it would do way more than a grounding mat.
Yeah.
Well, it's complementary to grounding, but yeah, you're right. It's like it's using electromagnetic frequencies of the earth, and it oscillates these frequencies. That's the pulsation that you get.
Super
and the technology says that the frequencies that the BEMER mat puts off is not any greater than the frequencies that the earth is putting off. So you're not like getting bombarded with super amount, because what they found out is you don't need a lot. It's not the intensity that works. It's a consistency that works, because one 8-minute treatment is supposed to have your circulation, your capillaries open up for 8 to 12 hours. Wow. And the more you do it on a daily basis, it lasts longer and longer. So just one 8-minute treatment. So if you do that once a day, at least you're going to next 12 hours, you're going to be doing really well.
Now,
what happens so you want to drink your water?
So what happens if someone's chronically dehydrated, they have low iron, they have low B12, or they have low nutrients that generally would, impair circulation?
Well, you said the first thing, they need to hydrate. One of the criteria to doing this is to hydrate. You have to drink water. And they recommend doing a mineral water, or actually spring water, because when you increase circulation, one thing that we see is that the more tissues are demanding getting blood flow. So then if you're already nutrient deficient, then you're going to get less minerals to tissues, especially muscles, and people can have cramps. So one of the side effects they see from a BEMER therapy, the only major side effect is sometimes people get muscle cramping, but that's only because they're already mineral deficient. And when you increase blood flow, then it just dilutes the mineral content in your body. So you want to do your minerals. You can do your green powders and green drinks that are mineral rich, like your spirulinas and your chlorella, your moringa, whatever you want to do that way, or just do spring water. But the water is a key, because it also it's a flushing technique going through, so you need that extra water. And when those capillaries open up, then your central pressure can go down a little bit. Okay, blood pressure, that was another mild to moderate reducing blood pressure after you do BEMER treatments for a certain period of time. There was a study on that. I don't have that, but that was one thing we looked at in our facility on a more anecdotal basis to see with people blood pressure.
And you're getting greater flow to the microvascular, so that's an overall decrease in systemic resistance of flow. And so when systemic resistance of flow goes down, then blood pressure goes down, and stress on the heart goes down. There was a question on biomagnetic therapy as well, Dr. Atkins. Is there some biomagnetic therapy we need to differentiate from this? Somebody asked about biomagnetic therapy. I'm not familiar with biomagnetic therapy. Maybe using magnets or something like that.
I don't know what he might be referring to, but the word BEMER stands for bio electromagnetic energy regulation. That's what the word BEMER stands for. So it's a biomagnetic therapy, for short answer.
Yeah. Okay. So it's a formula. So it may be the same thing. This may have the terminology a bit different. Now, someone asked about melatonin. Otis Granville asked about melatonin. I mean, that's a sleep aid. It's something produced by the pineal gland. And I guess that question came up related to improvement of sleep. What are your thoughts on melatonin? Anybody?
I don't really like my clients to get hooked on melatonin. Sometimes it can be helpful, like if you're traveling a lot and you need to support yourself, changing time zones and all that stuff. But I find that sometimes people get dependent on it.
Mhm.
And so I prefer to use like magnesium and natural things and talk to them about their stress and why their thoughts are running, late at night. Maybe you should journal before you sleep. Maybe you should, just listen to, ocean waves or whatever it is.
And turn off the light, the cell phone, the blue light you're getting from the cell phone light therapy. People
Yeah,
are
so
not
that gets into
conscious of
sleep hygiene, Dr. Montgomery, where it's
that.
like, okay, yeah, is your room too hot? Are you staring at your phone before? Because a lot of these things are small, but they add up, and most people don't pay attention to them. So I try to address all of those things in addition to how late someone's eating before they sleep. There's so many factors that can affect people's sleep. I try to do that versus giving them melatonin as a Band-Aid and then, hoping that they can wean themselves off of it.
So the Dr. Atkins walked away. So ask about who, please define healthy, who should not. That's a great question.
Great question.
Healthy. So this is you, Dr. Atkins, to define healthy. Some people think it's simply the absence of a defined diagnosis. I don't think that's the case. What are your thoughts?
Oh, you're on mute.
You're on mute.
Repeat the first part.
So it's there. Please define healthy. Who should not be using the BEMER unit? I think it's just the main question: who should not be using the BEMER unit? But I want you to define healthy. So, is there somebody who wouldn't benefit from it? I imagine.
There are very few people that wouldn't benefit from it because exercising would be a good option. That's one thing that BEMER helps you in is increasing blood flow. So anything you would do to increase blood flow could potentially replace the BEMER. But again, it doesn't replace microcirculation. If you're eating, say, for instance, animal products or high foods that are in fats, whether they're plant fats or you're eating any other toxins in your food, whether it's pesticides, herbicides, things like those things will clog up your system over time, but they have to be detoxified or flushed out or cleansed. And microcirculation is hard to get there. Now, again, that's why we age over time. I tell people when you don't get old, you get toxic over time. So, toxicity is the major function of aging. So when you have memory loss, when you're having shortness of breath, fatigue, that's, muscles are not functioning properly. That's where the fatigue comes from because you can't even produce energy. Brain function again, cardiac function, which ends up in heart failure. That's all of these things that add up. So if you want to do something proactively to maintain optimal health, that's something that you can include in your program, I think. But like I said, it's not specific for disease.
Dr. Atkins, so like I have generally low blood pressure. And I heard you say that if I did the BEMER, that the blood pressure would go lower. And I feel like mine is already so low generally that it probably wouldn't be a good idea for my blood pressure to go lower.
Well, no, those are relative term. Your body's going to adapt to whatever your normal perfusion. It's not so much the pressure, but the perfusion. So your body's going to maintain whatever the blood pressure needs to maintain, unless you're taking something to lower it, or unless you volume depleted, dehydrated. So we say high blood pressure, low blood pressure. Somebody with a blood pressure 120 over 80, that blood pressure probably can still be improved. Maybe it needs to be 105 over 65,
right?
Or 100 over 55.
Right.
So these numbers are kind of relative.
Okay, so you're saying that out.
No, and I can't explain any better than Dr. Montgomery. But yeah, your body compensates for it.
Okay.
One thing I want to say about the melatonin is, even people take melatonin. I agree with you that it's also that taking it, people get dependent on it, and the more they take it over time, it tends to work less. And people don't realize that when you do melatonin, you have to do it in darkness, that you take the medicine. But if you're in a room that has any amount of light in it, it's going to be less effective or not effective at all. So people took the melatonin, it didn't work. They had the TV on all night, or street lights in the room, and all those kinds of things. So those things people have to know about it. They think something's wrong, but again, the relaxation, it gets your mind slowed down. Move to Costa Rica somewhere. I don't know what to tell you.
Shout out for Costa Rica. Here's someone who wants to reverse an LVAD heart device. LVAD stands for left ventricular assist device. These are pumping devices that are implanted in the chest, and it helps circulation. This is for people with advanced heart failure. And the generic answer is yes. There are people who've been on LVAD devices and they've been taken off LVAD devices. And some of the more common cases I'm aware of are young people who have a viral cardiomyopathy or some transient form of heart failure. They get on the LVAD and then the heart improves, the LVAD goes off and the heart improves. I've had, I don't treat LVAD patients normally. When someone has an LVAD, normally they're treated by an advanced heart failure cardiologist. But we have had people come to our clinic in our health center with LVAD saying, hey, get me off this thing. And usually I try to coordinate their care with the advanced heart failure people because they're the ones that work with it. I do recall one young man who had an LVAD and he said, yeah, I would turn it off for a couple of hours and turn it on. And, he didn't feel any different. I wouldn't advise that because, these things can clot. You're on blood thinners. But the answer is, generically speaking, yes, but it's not a common thing. But if you want to be, if you have an LVAD, you want to be reversed, you want to do an intense optimal nutrition and therapeutic intervention, have a natural integrative cardiologist like myself or someone else working with an advanced heart failure cardiologist, both of whom are willing to sort of work with you and weaning you from that device. Let's see here. So these frequencies safe for those with poor diets. If you're on a poor diet, this is thought to be a synergistic therapy. Now, the study that I shared with you, these people were not on they were probably on a standard Western diet. In Germany, so they were eating, dead animal flesh and various other things. So they did get improvement. So the answer, I think, generally speaking, it is safe, but you want to make sure you're hydrated and your diet is not too outrageously bad. But people on the standard American diet, which in my definition is a poor diet, can tolerate this treatment. But you want to look at this as an adjunctive therapy, not as sort of the savior therapy. And so you want to be doing a lot of different things. That gives you the best chance for the best results. Toxicity can prevent sleep too. Yes, that's kind of a good message, take-home message. A toxic diet. For us, melatonin stopped working. Then we discovered it wasn't good for us. And then here's this is great information. Diet plays a huge role. And then thank you so much, everybody. So final words, Isosa, your takeaway message for our group before we sign off tonight. What are your final thoughts on this technology, but this whole subject in general?
Well, I think the technology is super cool. It sounds like the best way to use it is like you were just saying, like it needs to be done in tandem with diet. And it sounds like you can use it to optimize your nutrient absorption, but you got to give your body the nutrients it needs. You got to give it enough fluids, and you shouldn't just use this again as like another Band-Aid thing. But it sounds like it could really help people, especially who are having just need some drastic, improvement in their blood circulation. And then it sounds like for people who, are generally just looking to optimize their health, if they're getting the minerals and vitamins and the water they need, this is another way to just allow that to actually percolate faster.
That's right. That's right. Yeah, great adjunct to therapy. I agree 100%. 100%. Dr. Atkins, your final comments.
Well, again, I think it's a great tool just for increasing blood flow, because again, blood flow is everything in our life, and we need to really optimize that at every opportunity we get. So what I would say is, you can use the technology, yourself. I know, Dr. Montgomery, that you're looking into starting in your facility where people can pay and just have sessions, just like you would have massage sessions you can schedule on a periodic basis. You want to do a number of sessions in a row to see the benefit of it, and then doing it on a recurring basis. That will be very helpful. Like people get massages because it will have that benefit. And, if you really can appreciate it, you can go further and just get the technology for yourself. Because there's some tools, I think, for health and wellness we need in our household, just like we need a blender, a good Vitamix blender for preparing foods, or technology for that. But you have to take care of that also. And the benefit when it comes to detoxifying and cleansing your body, I think with this BEMER, it's what I call a cellular detox. It detoxes on the cellular level. It's getting things out that, that olive oil may not necessarily do.
and it certainly works right where the food works. And the last couple of questions about detox drink. I think any super green drink. We talked about things with spirulina, green algae, green smoothies, cold pressed juices, E3 Live. Someone asked, is a prescription? You can actually purchase one through a BEMER distributor. Dr. Atkins is a BEMER distributor, and you can get this. Just go to BEMER.com and just look on their website, and they can get you with a BEMER distributor near you, or reach out to Dr. Atkins, and he can work with you on this. It doesn't require a prescription, but they do sell through certain distributors. As usual, this has been a great show. Thank you, guys. I'm going to see you backstage, and thanks again for your contribution, as always. I'll see y'all shortly as I close out. And of course, another great show, in my opinion. Of course, I'm biased, but the BEMER therapy, as we pointed out, is an excellent technology that helps improve circulation at the microvascular level. And I think it's something for you to really consider, especially if you're diabetic, or if you have circulation problems that are already diagnosed. If you've had any kind of vascular treatment with stents or bypass in the lower extremities or in the heart, you very likely have microvascular disease. But if you consume the standard American diet, you're trying to make changes. This is a technology that can enhance your overall input. So I think you should give it some consideration, and look up the data yourself, and make your own opinion regarding this. So I hope you enjoyed this show. Give us a thumbs up. Please subscribe if you haven't had a chance to do so. And of course, share this information with loved ones, friends, and anyone who you think may benefit from it. Until next time, keep it fresh, natural, and live.